Well, a person in Ontario County has been diagnosed with West Nile virus. It's the first case in a decade, and health officials are reminding county residents to take necessary steps to prevent more infections. Ryan Hermanit brings us that advice. Ryan.
Hi, Teresa. Good evening. Public health officials in Ontario County tell me that they've been monitoring West Nile over the past few weeks at a statewide level following a case nearby in Seneca County where a horse tested positive just a couple weeks ago. They're now urging folks to be aware of the dangers of the virus and take proper preventative action. For the first time in 10 years, health officials say a person tested positive for West Nile virus in Ontario County. The county's director of public health says she's not surprised.
It's been really a long, hot summer, and it's been a really warm fall, and we still have mosquitoes out there, even though we're approaching the end of September.
The person with the virus is in their 50s, and officials believe it was contracted through a mosquito bite while outdoors north of the Finger Lakes region. Although this is currently the only confirmed case of West Nile in the county, Ott says it's important to look for warning signs after being bit by a mosquito, especially those who are most susceptible.
For somebody who's older, immune suppressed, you can develop illness. You can be tired, you can have a fever, you can have a headache and joint pain, and sometimes even a rash.
According to the CDC, 80% of those infected with West Nile are asymptomatic and may not even know they've contracted it. But there are preventative measures you can take.
Cover your skin, use some insect repellent, remove standing water, have good screens in your windows.
And if you notice an abnormal change in your health, go to your doctor.
Any illness that really isn't a cold, right? Or isn't like a GI upset. Any illness that involves fever in the summer, you should get checked out for diseases that can be spread by ticks and mosquitoes.
Now, I'm told that the person who tested positive for the virus is recovering, thankfully, but also suggested that folks check out the state's Fight for Bite campaign. And we've heard this throughout the year, of course, but just different preventative measures that you can take for mosquito bites. And for folks interested in that, that link is on our website, rochesterfirst.com.
All right, Ryan, many folks may be wondering what the treatment looks like for West Nile and how it's even diagnosed.
Yeah, so just, for reference on how it's diagnosed, it is through a blood test. Now, there are some things to keep in mind. The first and important thing would be to go to a doctor for an official diagnosis. Beyond that, if your symptoms are considered more mild, the headache and the fever, you can use acetaminophen, ibuprofen for those, and along with lots of rest and of course staying hydrated. Beyond that, though, if you're looking at the more severe symptoms, that's when you would want to go to a hospital or consider it at that point for IV fluids and potentially more drastic sorts of treatment beyond that point.
All right, Ryan, thank you so much for that information.
Get the Rochester First streaming app today for everything you love from News 8 on demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.